My name's Paul Attwal. I'm Head of Performance for Operations at Whittington Health. The project's called Sustainable Long Length of Stay, and the key is around using something called mini-made events, which is a multi-agency discharge event. So the key people involved, we have our own internal staffing, which will include our discharge planning team, which will include our junior doctors, our consultants, therapists on the wards, therapists outside of the wards, and then linking in with social services, social workers, and other stakeholders from commissioning groups to help facilitate those discharges. We did a number of things. The key tool that we've used is around using a PDSA cycle. So nothing complex, but really looking at plan, do, study, act to help us facilitate discharge in a timely way. We've been doing this project for the last 2 years and it's gone through various stages of improvement. What we are looking at in terms of the actual outputs is around how we use that data, and we currently use a upload, which is a national requirement around long length of stay, i.e. patients over 21 days, using a variety number of codes for those patients who are fit versus non-fit, and that's recorded once a week. What we've done is, when we initially started the project, we did our mini-mades once a week. As things progressed and as we managed through the cycles, we moved to twice a week, where the first session on the Tuesday would be looking at reviewing everybody over 21 days, and on the Thursday we would invite externals, so our social services colleagues, our commissioning colleagues, to sit around a table to continue that review. We've now moved that on further, where on a Tuesday we now do the review directly on the wards, and that's really about ensuring we've got that clinical engagement to help people understand what's going on with individual patients. What we also now do is we're looking to move towards something called Whittington Flow, where we're looking to change the whole cycle of management of flow, which includes a review of over 21 days. On a Monday, what we're looking to do is have a meeting-free day, so everyone involved in flow is there to help facilitate discharges from the weekend, recovering from the weekend. On the Tuesday, we did the long length of stay on the wards with clinical engagement. On the Wednesday, we look to follow up all the actions that we have from that Tuesday. On the Thursday, as we've been doing, we did the long length of stay with our external colleagues around a table. What's different now is that we look to use Fridays to help follow that up, so we've got sufficient capacity going into the weekend. One of the key things that we're also looking to do as part of the new cycle is around ownership of flow. And we're pushing it very much that ward managers in particular, who are the key to understanding what's going on with their patients on their wards. So the idea is to empower them to help facilitate those discharges, to understand where we're going with them. What we're also doing as a whole system is have a group which is looking at outflow, and that's facilitated through commissioning leads from Islington CCG and Haringey CCG to help facilitate that. And then looking at what are the blockages, what can we do as a whole system to help manage flow.